Can you believe that the Center for Medical Humanities and Ethics is celebrating our 20th anniversary?
No, I cannot. It's pretty incredible to see how much the center has grown over the past several years. I've been able to be a part of the team.
I remember very distinctly, you're one of the people that stand out in my mind, that you came to my office the first semester of your first year of medical school, seeking me out, stating that you would like to participate in CSL and how could I help you with that. You know, you had just begun medical school. Why did you want to add CSL to your plate so soon?
I really remember during our orientation, Dr. Bergen speaking about the center. As soon as she was talking, it immediately occurred to me that the center was going to be my professional home away from home. What specifically stood out to me about the CSL program was that it centered the voices of the communities that we were caring for. And that's ultimately what I wanted to be able to do. Oftentimes we talk about compassion and empathy as an inherent quality rather than a skill that we develop. And I think the tools that we build during the CSL program really allowed us to learn what compassionate and community-centered care looks like.
I was thinking this morning about an analogy that relates to what you're saying, because it's the students who bring the spark. So you, as an incoming medical student, you had the spark, and our goal with the CSL program is to provide the wood and the kindling to help that spark grow into a flame. And we're here, to keep that fire lasting throughout your 4 years of medical school, because it can get tough and you may lose some of that insight about empathy and compassion that you had when you first entered medical school. So thank you for bringing that up. That's an excellent point.
I've always wondered what inspired you to lead the CSL program. And even more specifically, I remember that you've always had a passion for health literacy. So how did you develop that? Because I think your passion for what you do has driven us to want to do better and grow as trainees.
I love bringing the two parties together. So matching the students with the organizations that need their help. At the same time, I always want to make the point that it's not just a one-way street. The students get so much from working with the community, learning about all of the assets that we have in our community, as well as the needs. I think it really influences the professional development of our students, getting them out into the community and meeting real people who have real health needs is just, in my opinion, the best way to cultivate that kind of physician in the future who's going to be community oriented. And then you also bring up health literacy, which is a topic I'm very passionate about. Since day one, I've been trying to bring health literacy into our CSL projects as well as into the curriculum of our students. You and your colleagues actually got to work on a project on health literacy that I mentored, which is why we got to know each other so well.
So the project that we got to work on together and you mentored me on was the Act Together for Health project. And this was around the time when the Affordable Care Act was just being rolled out for the first time. Our goal was to figure out how do we help our community understand how to access some of the benefits that came out from the Affordable Care Act. We had the honor of working with our community partners to develop a smartphone app to allow the community to access information about how do you enroll to get insurance or healthcare coverage through the Affordable Care Act. That project was definitely one of my most meaningful experiences as a medical student. I kind of look back at this as the community had more of an impact on me than I'm even sure we had an impact for them. When I look back on it, I'm just so excited that we even had that opportunity in the first place.
Anu, I want you to know that ACT is still alive and well. To this day, it still exists. There's still a need for it. I actually use ACT as an example of a community identified need. That is the core of CSL, is that we are reacting and responding to what the community has said is a need versus what we think. And there's 2 times in a project period that stand out. So one is when I get a new student who comes to me fresh-eyed, wanting to get involved in a project, just like you did in your first year. And it's such a simple matter to sit down with them and hear what their interests are and connect them to a project or to a faculty mentor or an organization. And yet it makes, like, they just are so appreciative of it, and it like changes their world right then and there, because they have now a direction to go, and they can go start working on serving the community. So I love that beginning period, but I also love the end period when I get to see our students showcasing their work, because it shows that they get recognition for all the hard work and service that they've done above and beyond their curriculum during their time as a medical student.